Hello to all my professional fellows. Myself, Dr. Megha, Physiotherapist, MPT Neurology. Today, we all are performing our duties selflessly as a medical professional and paramedical professional. In the current scenario, we are using PP kits and masks for long period of time constantly. This can cause some health issues also. So, one of them is neck pain. So in order to prevent this, I will teach you some exercises. When we use the PP kits and masks for long period, this will lead to overfiring of some muscles and weakening of some other muscles. And this imbalance will cause many problems like headaches, stiffness, tightness, neck pain, shoulder pain, etc. In order to prevent, we will learn some exercises, right? Now, the first exercise is, first we have to lose our neck muscles. For this, we have to rotate our neck like this for 5 minutes with very light pressure. 5 repetitions, both sides, and then side turns. Then extension, flexion, extension, flexion. After that, we will start stretching exercises. First muscle which we are going to learn is upper trapezius. Because of this bad posture, these muscles get tensed. So in order to relax this, if I want to stretch my left trapezius, I have to keep my left hand under my left thigh, and then in the straight alignment, I have to put my right hand on the lateral side of my left occiput, and then stretch this. Pure side flexion movement. Maintain mild stretch for 30 seconds and then relax. Repeat this on your right side. Put your right hand under your right thigh and then your left hand on your right parietal region and then pure side flexion. Remember, this should be pure side flexion. You should not rotate your neck and then side flex. This will not stretch your trapezius, it will stretch your other muscles. So for trapezius, this alignment should be very straight and then pure side flexion with no rotation. Maintain this light stretch for 30 seconds and then relax. Repeat this exercise bilaterally 3 to 4 times. Now the second muscle is sternocleidomastoid, which is attached from back of the ear to the medial end of the clavicle. This is your sternocleidomastoid. If you want to see this, just rotate your head and this muscle will pop out. So in order to stretch this muscle, this is really very important muscle. As we are wearing the mask and working in the protruded head posture, this will get more overfired and tensed. So in order to release this muscle, we have to stretch this muscle lightly. So if I want to stretch my left trapezius, first I'll pop out my muscle, then keep your hand here so that you can feel the stretch in this muscle, not in any other muscle. Now rotate your neck to opposite side and then tilt your head back as if you are looking at the ceiling of your right side, and you can feel the stretch in SCM. Adjust the neck alignment so that you can feel the stretch in this region only. And then count to 30 seconds and then relax. Similar procedure for your right SCM. Just pop out your SCM, hold your fingers here, depress your shoulder, this side shoulder, then rotate and head tilt at back. You can feel the stretch. It should be very light. Count to 30 seconds and then relax. Repeat this exercise bilaterally 3 to 4 times. Now the next is scalene, which comprises the anterior lateral aspect of the neck. It comprises of anterior, middle and posterior scalene. If I want to stretch my left side, then I have to depress my If I want to stretch my left side, then I have to put my hand on the right side and then rotate your leg, bend your neck as if you are smelling your right axilla, and then extend your neck. In this, we will stretch all the 3 scalene muscles. Maintain this stretch for 30 seconds and then relax. Repeat this for this next left side. Put your hand on your left shoulder. Sorry, right side. Put your hand on your right shoulder. Rotate. Bend as if you are smelling your armpit and then extend. Maintain this stretch for 30 seconds and then relax. Repeat this exercise bilaterally 3 to 4 times. Now, next is our suboccipital region. When we work in this position, these muscles get tensed. So in order to relax these muscles, we have to stretch these muscles, posterior aspect of suboccipital muscles. So for this, you should depress your shoulder, then tuck in, and then bend your neck. You can feel the stretch at superior posterior aspect of your neck. Maintain this position for 30 seconds and then relax. Remember, tuck in should be like this, not like this. Tuck in, this movement is purely at C0, C1 level. Tuck in and then flex your neck, bend your neck. Repeat this exercise 3 to 4 times. Now, the next is our levator scapulae. This muscle originates from your medial border of scapula and get inserted over your travels on the lateral aspect of your posterior lateral aspect of your neck and get inserted at the posterior part. So in order to stretch this muscle, what we have to do is, if I want to stretch my left side, put your hand like this so that your elbow is pointed towards ceiling, and then from your right hand, put your right hand on your posterior lateral aspect of occiput and stretch your levator scapulae as if you are looking at your right thigh. Maintain this stretch for 30 seconds and then relax. We are keeping this hand in order to relax our upper traps. Otherwise, in this exercise, we will stretch other more muscles. In order to isolate the levator scapulae, we are putting this hand and then stretching our purely levator scapulae muscle. We can repeat this exercise on the right side. Again, keep your hand like this and then your hand on the posterior lateral aspect of your head. Bend your neck as if you are looking at your left thigh. Maintain this stretch for 30 seconds and then relax. Repeat this exercise bilaterally 3 to 4 times. Now we stretched all these muscles, but one more muscle we can work on is pectoralis major. In the rounded shoulder, when we are working with this, our pectoralis major get tensed. In order to stretch this, we can stand in front of the corner of the wall and abduct your hands at 140 degree. Place your hands on the wall and then move your body ahead with your neck in the same alignment. You should not protrude your head. It should be like this. Stretch the pectoralis major. Maintain this stretch for 30 seconds and then relax. Repeat this exercise 3 to 4 times. After this, when we are wearing the mask, we release our SCM, but these muscles also get tensed. One of the muscle is temporalis. So we have to keep our fingers like this. We have to take our 2 fingers and keep it here. Here is the temporalis muscle. So in order to relax this, just give 10 clockwise direction movement. The movement should be very firm and light. You should not rub the finger. It should move the muscle in the circular pattern. 10 rounds clockwise and 10 rounds anti-clockwise. In this way, we can relax our temporalis muscles, which help us in preventing our headaches. We are using goggles also, we are using face shields, so we should relax our temporalis. Now the next is digastric muscles. Our digastric muscles has two heads, anterior and the posterior head. Majorly our posterior heads get involved as we are wearing gadgets and working in the bad posture. So in order to relax the digastric, what we have to do is we can use the thumb or we can use the two fingers. Place these fingers below the ear and behind the ear. Your pressure should be very light as major nerves are passing from here. It should be very light and firm. Rotate and then this is your digastric. Just do this repetition 10 times or further. You can relax the myofascia. Relax the digastric muscles bilaterally. Repeat this 10 times and then relax. Now we relax our overfired muscles. Now we have to strengthen some weak muscles so that we can maintain the good posture. One major muscle which gets weak is the lower trapezius. So what we have to do is we should bend our elbows at 90 degrees and pull the table in front of you towards you. This is purely an isometric exercise and you can feel the tension between the angle of scapula. Maintain this contraction for 15 counts and then relax. Remember again, your posture should be straight. It should not be like this. It should be straight and pull the table in front of you. It's very easy. You can do it anywhere while sitting on the table and chair. Relax. Next is our serratus anterior. We all know that this muscle allow the scapula to place close to the ribs on the posterior aspects. So in order to strengthen our serratus anterior, we can do push-ups, either the wall push-ups or the floor push-ups, so that our scapula will come in close proximity to the ribs, like this, and just push the wall or the floor from your hands, and you can feel the contraction of the serratus anterior at the medial border of the scapula. It's get tensed. Maintain this stretch for 15 seconds and then relax. Repeat this again for 3 to 4 times. And the next muscle which get weak is deep neck flexors. Our superficial neck flexors are overfired, but our deep neck flexors got weak, so that we get a bad posture. So in order to strengthen these muscles, what we have to do is we have to do tuck in with straight alignment. Tuck in your neck. Maintain this position for 15 seconds and then relax. You can feel the stretch here. Repeat it 3 to 4 times. Once you master this, go to the second level, in which you perform this exercise in the supine line with the head lift. This will further help you to strengthen your deep neck flexors. So please do this exercise at least once a day, so that we can prevent our neck pain and maintain our good posture. Thank you.